Chapter 14 Study Guide. Be able to calculate cardiac output. Cardiac output is the volume of blood pumped per minute by each ventricle. Increasing heart rate increases cardiac output. Stroke volume is how much blood is pumped each heartbeat, and it is the end diastolic volume minus end systolic volume. For example, there is 125 milliliters in a full ventricle and 55 milliliters in the ventricle at systole. Cardiac output is measured in milliliters per minute, and it is equal to the stroke volume, milliliters per beat, times cardiac rate, which is beats per minute. Familiarize yourself with intrinsic and extrinsic signals that can alter heart rate. Intrinsic signals come from the heart itself. Increased venous return increases end diastolic volume and stretches cardiac muscle fibers more. This causes preload. And as preload or fibers more, this is known as preload. As preload increases, so does cardiac output, which means that the heart rate has risen. Greater preload is greater stretching, and that means increased contractile force, which means a greater stroke volume. Preload and venous return increase during exercise as vessels and skeletal muscle dilate. Muscular contractions put pressure on veins, increasing the rate that blood returns to the heart. Extrinsic signals come from neural and hormonal signals. Parasympathetic are less impactful than sympathetic. They can decrease heart rate during rest via continuous signaling. Decreased signaling during exercise can boost heart rate. Acetylcholine, a neurotransmitter, alters membrane permeability to potassium, resulting in hyperpolarization and longer time to depolarize, resulting in delayed action potentials. Sympathetic signaling can increase heart rate and force of contraction. It's limited to increase to about 170 to 250 BPM, as at that rate, ventricular filling is incomplete, reducing end diastolic volume and decreasing cardiac output. Be able to explain why fluids move out of capillaries at the arterial end and into capillaries at the venous end. How do blood pressure and osmotic pressure impact this? What would happen if they were to change? Fluid in the capillaries moves from the arterial end to the venous end because the pressure in the arterial end is higher than in the venous end. No difference in pressure would result in no flow. This happens in death. So capillary exchange, I'm looking at a slide right now. Capillary exchange and regulation of interstitial fluid volume. Positive filtration pressure forces liquid out of the capillaries at the arterial end. Okay. I'm looking at a figure right now, 14.9, the distribution of fluid across the walls of a capillary. Interstitial fluid is formed by filtration. As a result of blood pressures at the arterial ends of capillaries, it is returned to the venular ends of capillaries by the colloid osmotic pressure of plasma proteins. Numbers indicate pressures in millimeters of mercury. The fluid returning to the venular ends of capillaries is less than the amount filtered out of the arterial ends, and the excess interstitial fluid is drained by lymphatic vessels. So, yeah, you're just going to have to look at this slide because it looks confusing. How does vascular permeability change? Changes in blood osmolarity and blockage of capillaries cause edema. Edema is the excessive accumulation of interstitial fluid. This condition is normally prevented by proper balance between capillary filtration and osmotic uptake of water and by proper lymphatic drainage. Edema may thus result from many factors. Vascular permeability means edema can be caused by alterations And vascular permeability caused by inflation. Oh, okay, I see, yeah. So now I'm reading all the three things. Vascular permeability. Edema can be caused by alterations in vascular permeability caused by inflammation. Leakage of plasma proteins into the interstitial fluid, which causes reduced osmotic flow of water into the capillaries. This occurs during inflammation and allergic reactions as a result of increased capillary permeability. Blood osmolality. I have the same passage for that. Leakage of plasma proteins. ... Blockage of capillaries. Venous obstruction, as in phlebitis, where a thrombus forms in a vein, or mechanical compression of veins during pregnancy, for example, which produces a congestive increase in capillary pressure. Obstruction of the lymphatic drainage due to parasitic larvae and elephantiasis, or to surgery. Breast surgery is a leading cause of lymphedema. Okay. Where are the fluids of the body distributed? I'm looking at figure 14.8, the distribution of body water between intracellular and extracellular components. The extracellular compartment includes the blood plasma in the interstitial tissue, aka fluid. So 27 to 30 liters of the body fluids are in the intracellular compartments, and 14 to 16.5 liters are in the extracellular compartments. For the extracellular, the interstitial fluid volume is 11 to 13 liters, and the blood plasma volume is 3 to 3.5 liters. Be able to describe how blood volume, pressure, and osmolality are controlled by negative feedback using antidiuretic hormone, renin, angiotensin, and aldosterone. Okay, I'm looking at two figures 14.11 and 14.12, and you're just gonna have to look at these. I'm not reading them right now. I can't begin to comprehend. What happens to blood pressure as the blood travels from the left ventricle and back to the right atrium? Why is this important to ensuring a unidirectional flow of blood in the body? It decreases, the blood pressure decreases. When it leaves the left ventricle, it is 120/80, or about 100 mm of mercury. And when it returns to the right atrium, it is 0 mm mercury. This is important because blood will flow from high to low pressure, and this will prevent backflow into the ventricle because the pressured blood will move to the arteries and arterioles and veins that are lower in pressure. What is the difference between laminar and turbulent flow? How is turbulent flow useful in measuring blood pressure? Laminar flow occurs when all parts of a fluid move in the same direction, parallel to the axis of the vesicle or of the vessel. The term laminar means layered. Blood in the central axial stream moves the fastest, and blood flowing closer to the artery wall moves more slowly. If flow is perfectly laminar, there is no transverse movement between these layers that would produce mixing. The blood flows smoothly and doesn't produce vibrations of the artery wall that would cause sounds. Turbulent, by contrast, is when some parts of the fluid move in different directions, churning and mixing the blood. Turbulent flow causes vibrations of the vessel, which may produce sounds. Before the blood pressure cuff is inflated, blood flow in the brachial artery has very little turbulence and so is silent. When the artery is pinched, however, blood flow through the constriction becomes turbulent. This causes the artery to produce sounds, much like the sounds produced by water flowing through a kink in a garden hose. The ability of the cuff pressure to constrict the artery is opposed by the blood pressure, so the cuff pressure must be greater than the diastolic pressure to constrict the artery during diastole. If the cuff pressure is also greater than the systolic pressure, the artery will be closed off and silent during both diastole and systole. Turbulent flow and the sounds produced by the artery because of this flow can occur only when the cuff pressure is greater than the diastolic pressure, in parentheses, to constrict the artery during diastole, but less than the systolic pressure. The constriction can then partially open at each systole and allow turbulent blood flow. How it can help measure blood flow, I'm looking at figure 14.30, the blood flow and Corot cough sounds during a blood pressure measurement. When the cuff pressure is above the systolic pressure, the artery is constricted, closed, and there are no sounds. When the cuff pressure is below the diastolic pressure, the artery is open and flow is laminar, producing no sounds. When the cuff pressure is between the diastolic and systolic pressure, blood flow stops at each diastole and resumes with every systole. The turbulent blood flow through the partially constricted artery each systole produces the Corot cough sounds. This is so fun. What is blood pressure? How is it measured? Blood pressure is the pressure of blood pushing against the walls of your arteries. Blood pressure is measured with the oscillatory method, the inflatable rubber bladder within a cloth cuff wrapped around the arm and a stethoscope over the brachial artery, aka a pressure cuff, and manometer are used to measure blood pressure. Systolic is the top number, diastolic is the bottom. Be familiar with Poiseuille's law, qualitatively, not quantitatively. What happens to blood flow if pressure, resistance, or viscosity changes? Okay. Although the total blood flow through a system of arterioles must be equal to the flow in the larger vessel that gave rise to those arterioles, the narrow diameter of each arteriole reduces the flow in each according to Poiseuille's law. Blood flow and pressure are reduced even more in the capillaries, which are located downstream of the high resistance imposed by the arterioles. The slow velocity of blood through the capillaries enhances diffusion across the capillary wall. See section 14.3 and fig 14.15. Rate of flow can be calculated according to Poiseuille's law. You're just going to have to look at this, but it said qualitatively, not quantitatively, so you shouldn't have to know it. Okay, pressure change. If pressure at both ends of the vessel is the same, there will be no flow. If the pressure at one end is greater than the other, blood will flow from the region of higher to the region of lower pressure. Pressure difference is abbreviated as delta P, because delta means change in. A resistance change, blood flow lessens with an increase in resistance, and a decrease in resistance will increase blood flow. Blood flow is decreased with increasing viscosity. Think of honey. How does the diameter of a blood vessel impact the resistance to flow? A large diameter means there is increased blood flow as resistance is decreased. It is the opposite for smaller vessels. There is increased resistance. How does blood pressure, vessel diameter, and blood viscosity impact blood flow, which has the greatest impact? Blood pressure. High blood pressure can damage your arteries by making them less elastic, which decreases the flow of blood and oxygen to your heart. Vessel diameter. Rate of flow is increased as vessel diameter increases. Blood viscosity. If the blood is very viscous due to dehydration or an abnormally high number of red blood cells, blood flow will be decreased. Think of honey going through a tube. Vessel diameter has the greatest impact on blood flow. Check the numbers in fig 14.15. How does the cross-sectional area of a vessel impact the rate of blood flow through that vessel? I'm looking at figure 14.25, the relationship between blood pressure and the cross-sectional area of vessels. As blood passes from the aorta to the smaller arteries, arterioles, and capillaries, the total cross-sectional area increases. This results in a drop in the blood pressure within each of these vessels. So when it says this, I think Oh, I don't know. Okay, I mean, yeah. Yeah, okay, so this results in a drop in the blood pressure, and how does this impact the rate of blood flow? Well, when it reaches the capillaries, the blood flow will be reduced or decreased. It will slow down because of how small the capillaries are. And as blood passes from the aorta to smaller arteries, arterioles, and capillaries, the total cross-sectional area increases. Which type of vessel is more resistant to flow, the aorta or capillary? Why? Capillary is more resistant to flow because it is much smaller than the aorta, and smaller vessels have increased resistance. How does vasodilation and vasoconstriction impact blood flow? Vasodilation: when vessels increase in size, resistance is decreased and rate of flow increases. Blood pressure is highest in arteries and decreases as vessels get smaller. Vasodilation decreases resistance and increases flow. Vasoconstriction: resistance increases and rate of flow decreases in smaller vessels. Rate of flow is lowest in the capillaries. Vasoconstriction increases resistance and decreases flow. In quotations, the rate of blood flow to an organ can be increased by dilation of its arterioles and can be decreased by constriction of its arterioles. What is pulse pressure? What is a normal pulse pressure in a healthy individual? Pulse pressure is what you feel when you take your pulse. It is the difference between the systolic and diastolic pressure in the blood. Pulse pressure equals systolic pressure minus diastolic pressure. Because the pulse is produced by the rise in pressure from diastolic to systolic levels, the difference between these two pressures is known as the pulse pressure. A person with a blood pressure of 120/80 would therefore have a pulse pressure of 40 mmHg. I believe that would be the normal pulse pressure in a healthy individual. Well, why might you get dizzy if you get up suddenly after lying sitting for extended periods of time? There's a slight drop in blood pressure as blood temporarily pools in the lower body, and this can cause dizziness. What role do precapillary sphincters play in regulating blood flow to tissues? Be able to provide examples of times when blood flow is increased or decreased to tissues. Precapillary sphincter muscles are at the origin of a capillary and regulate the flow of blood through the capillaries. They direct blood flow into capillaries, and they can allow more blood to tissues that need it and reduce flow to inactive tissues. With our ears, for example, the sphincters can allow more blood to flow into them, allowing us to lose body heat more quickly. Alternatively, they can stop blood flow from entering the ears to maintain more body heat. For example, when the body is overheating, blood will be pushed to the ears to release the heat more quickly. When it is very cold out, much blood is not in the ears, but instead moves deeper within the body to maintain warmth. What is hypertension? What problems can cause it? How can diet positively or negatively impact hypertension? Hypertension is high blood pressure. High sodium diets play a major role in causing hypertension. Kidneys are essential in controlling it. A diet high in potassium leads to increased urine volume and is helpful in addition to reduction in sodium intake. Hypertensive effects are often not noticed until they become serious. There is the risk of vascular damage leading to stroke or heart attack and development of hypertrophy in ventricles, which is overgrowth of ventricles leading to arrhythmia and possibly heart failure. Hypertension also contributes to atherosclerosis. People with stage 1 hypertension should reduce sodium intake, alcohol consumption, and exercise regularly. People with stage 2 usually have to take medicine. Passage from the book says hypertension is blood pressure in excess of the normal range. Hypotension that is a result of known disease processes such as chronic renal failure and adrenal tumor is called secondary hypertension. Of the hypertensive population, secondary hypertension accounts for only about 5%. Hypertension that is the result of complex and poorly understood processes is called primary or essential hypertension. What is mean arterial pressure? How is it calculated and regulated? Be familiar with baroreceptor reflexes. Mean arterial pressure is also known as MAP, and it is the average arterial pressure during the cardiac cycle. MAP equals Diastolic pressure plus 1/3 of the pulse pressure. Baroreceptor reflexes. In order for blood pressure to be maintained within limits, specialized receptors for pressure are needed, and these are baroreceptors, and they are in the aortic arch and carotid sinuses. These receptors are constantly active, producing a baseline frequency of action potentials in their sensory neurons. An increase in blood pressure causes the walls of the aortic arch and carotid sinus to stretch, resulting in an increased frequency of action potentials along their sensory nerve fibers. A decrease in blood pressure causes a decreased frequency of action potentials in the sensory fibers. You're also going to have to know the negative feedback control of blood pressure by the baroreceptor reflex. That's figure 14.28. I am not reading that right now. The baroreceptor reflex consists of 1. The aortic arch and carotid sinus baroreceptors as sensors, 2. The vasomotor and cardiac control centers of the medulla oblongata as the integrating centers, and 3. Parasympathetic and sympathetic axons to the heart and blood vessels as the effectors. Acting through the baroreceptor reflex, a fall in blood pressure evokes an increase in sympathetic nerve activity while the activity of the parasympathetic division decreases. As a result, there is a compensatory increase in cardiac output and total peripheral resistance. Be familiar with examples of both intrinsic and extrinsic regulation of blood flow, as well as the difference between metabolic and myogenic regulation of blood flow. Intrinsic regulation. Some organs are capable of autoregulation. They can use intrinsic control to maintain constant blood flow despite changes in global blood pressure. Extrinsic regulation can be sympathetic and parasympathetic. For sympathetic, adrenergic sympathetic fibers cause vasoconstriction in the skin, kidneys, and digestive tract. Cholinergic sympathetic fibers cause vasodilation in skeletal muscles, also caused by epinephrine produced by adrenal glands. For parasympathetic, cholinergic parasympathetic fibers cause vasodilation in viscera, salivary glands, and genitalia. Metabolic regulation. Accumulation of carbon dioxide, metabolic products, and paracrine regulators. This prevents blood flow to a limb, for example. All I just have is metabolic regulation. The accumulation of carbon dioxide, metabolic products, and paracrine regulators. For example, preventing blood flow to a limb. Okay. Myogenic regulation. Dilation/constriction of smooth muscle and arterioles supplying blood to the brain. Be familiar with the basics of shock. Circulatory shock occurs when there's inadequate blood flow and/or oxygen utilization by the tissues. Blood flow to the heart and brain is maintained at the expense of other organs. Hypovolemic shock is circulatory shock that is due to low blood volume and might be caused by hemorrhage, dehydration, or burns. This is accompanied by decreased blood pressure and decreased cardiac output, as well as rapid pulse, cold skin, and reduced urine output. Septic shock is caused by infection. Anaphylactic shock is caused by allergies. You see a rapid fall of blood pressure, which occurs as a result of a severe allergic reaction. This can happen from bee stings or penicillin. Neurogenic shock is caused by damage to the CNS. You see a rapid fall in blood pressure. Cardiogenic shock is caused by cardiac failure. There is inefficient cardiac output to maintain tissue perfusion. This may be caused by severe cardiac arrhythmias or valve damage, or infarction that causes the loss of a significant proportion of the myocardium. Infarction means obstruction of the blood supply to an organ or region of tissue, typically by a thrombus or embolus, causing local death of the tissue. All right.